Thank you, Karuna ma'am. That was an amazing story of your client. So with this, we'll move on to the next interesting case study, which is presented by our coach Revati. And it is about emotional healing of a teenage girl. Over to you, Revati.
Good afternoon, everyone. So this is a story of a 43-year-old woman who came to me to heal her teenage daughter. And the first call was a video call. And she started narrating what has happened to her daughter. Within few minutes of the narration, she fainted. Imagine someone fainting at the other end, And then I understood, okay, now the teenage daughter is not the person or the client who's need the healing, but the mother herself. Then she regained back her consciousness after a few minutes. Then she started narrating. So what happened is her daughter has faced a very bad traumatic experience at the age of 5, which she came to know at the age of 14 until the mother wasn't aware about that. And then the daughter started behaving very weird, emotionally imbalanced, and always slipping to the age of 5-year-old. Imagine a 14-year-old slipping into 5-year-old. Eventually, that daughter started with psychiatric medicine. So the mother kept saying only one thing. Next slide, please. The mother kept saying something like, I failed as a mother. Then I started exploring her childhood. Her childhood was not that good. She had a very challenging childhood. Father and brother, who are the masculine energies, the men in her life, were not that supportive, were not that loving, but rather they were like more kind of a threat and fear to her. Especially the brother always used his masculine energy, like attacking her, abusing her verbally. So these kind of things. And she got married. She didn't get the support from her husband, what she was expecting, though the husband was really good person. Then she got, the mother was always sick. She never knew the reason behind the sickness. And she lost her mother in 2008. Before even she processed the grief of losing her mother, who was the only person who was a pillar of support, she just passed that grief to her daughter, where she delivered her daughter in 2009. And eventually in 2013, she got diagnosed with bipolar and started with the medication for the same. Now after about 15 sessions, something very profound shifted. She started becoming lighter, she started becoming calmer, and her psychiatrist was very surprised, psychiatrist. So he reduced the dosage, he almost made it a nil. He just gave an SOS medicine if required. So she was on 12 years of the antipsychotic medicine, but with 15 sessions, we were able to make it 0. And the most important outcome, the daughter was refusing primarily not to step on the healing program with me, but eventually she agreed to join me. And how it was achieved is like, just please keep changing the final slide. So this was not something anything against medicine, and this was not just emotional talking. But what we did is, we first made sure that she felt safe, okay, through breathing, grounding, and then we worked on perception, which really shifted. That was the turning point. I started talking about Ardhanarishwara, because that was something she has to really focus upon, as she has to release her anger and fear towards the men. And she had seen only the misuse of masculine energies, and I started telling her masculine energy and feminine energy complement each other, it doesn't compete each other. And then she started doing those holistic tools through like unposted letters, forgiveness letters, Ho'oponopono, meditation. And then we were able to see a profound shift. So when the mother shifted, the home shifted. That's when the daughter felt safe enough to say yes for my program. And this is the very important lesson what I learned. Sometimes the universe brings a child to awaken the unresolved wounds of the parent. When the mother healed her inner daughter, the external daughter felt safe enough to step forward. Thank you so much.
Thank you, Revati. With this, we have the next presenter on stage, Mrs. Jyoti Srinivas. And she will beautifully explain about her client, 42-year-old client, who has prevented the surgery as she was suffering from ulnar dislocation. Over to you.
Thank you, Kavita. Good afternoon, everyone. So most of us can relate when there is a pain, we think that there is some kind of injury that might have happened. It's very common. But what if there is a pain without a damage happening? What if there is a pain which is not because of failure, but because of protection? So let me present a case today which helps us to understand why did I ask this question. So this is a case of a 42-year-old woman who is a tutor and a homemaker. She was presented with a severe wrist pain, and the pain was so intense that she was not even able to lift a spoon of rice to herself. And the X-ray showed a distal radio-ulnar dislocation. This usually happens among cases of trauma, accident, injuries, falling off, but none of such things were there for my client. It is just a usual household course and routine. Then the doctors advised her to be on a wrist splint, and a microsurgery was recommended if needed. And looking at the condition of the patient, and when we studied more in depth, what we understood is there are a lot of postural imbalances. There were a lot of, how we carry our weight over the body improperly. And there's a lot of emotional suppression and physical overload and exhaustion in life. And again, let's think about it, why all these things are happening when there is no injury to the body. Let's take a pause and understand what the body is trying to protect from what. So I will bring up the result first. Later on, I'll bring back to what we have actually done. What happened, the change is the pain disappeared in few weeks' time. She was totally on to the physical chores that she was on to with complete confidence, without fear, and with a lot of courage. When she started doing Surya Namaskaras, a few Surya Namaskaras used to push her into pain. But by the end of the program, she was able to do 108 Surya Namaskaras without pain. And the way she moved herself, like the difficulty from lifting a spoon of rice to feed her own self, to the way she raised herself, her entire body, with a lot of confidence and ease, is what brings up the change in this case. And how did we achieve this? So what we initially did was we addressed the physical challenges. There was a lot of postural issues. So most of the common problem with all the physical pain and musculoskeletal disorders these days is posture. So we worked on the posture. Then we worked on how she was carrying her own body weight along with the external weight that we carry, and how to balance that equally on either sides of the body is taught. And a gradual strength training was introduced to bring up the confidence in movement. And then it didn't stop there. There is more to the story. You know, we always believe that more profound things are happening on the other end, where we believe that body doesn't only contain bones and muscles. 70% of it is water. If that is the case, what if we can make the water as a source of treatment? So the modern research indicates that water has a language which responds to our thoughts, emotions, and our intentions. And the famous Japanese scientist, Dr. Emito, has proved this through his experiments. So we tried the same technique with my client with various water-based rituals, which is mindful hydration and gratitude practice and water-based affirmations, which bring up a shift in the parasympathetic nervous system, which is nothing but the healing force of the body. And when the nerves relax, the muscles do the same, and obviously the joints has to align. And that's what bring up the change. The difference between the two joints was reduced, which you could have seen in the earlier picture of the X-ray. When what we believe in is when the water in the body is calm and cool and aligned, everything falls in place and the body will heal on its own. So thank you so much for listening to me.
Thank you, Jyoti. That was an amazing presentation. So here her story speaks about how we balance our emotional burden with our physical activity in the posture, right? How many of you agree and were able to relate with this? Right. So next we move on with a client testimony. So I invite Shweta Agarwal here, Sandhya's client, to share your experience on stage.
Hello everyone, myself Shweta Agarwal. I am a client of Sandhya Rani. I just want to convey it as a small story. Maybe it's not boring. I consulted Sandhya for weight loss. She took my medical history, for family history and all. As one of the ma'am said, mother-in-law and daughter-in-law, there is a major problem in India. So I have the same problem with me. So first she took my family history and all. She explained me about the holistic tools. And I asked her about the diet. She said, "ठीक है, you follow the same diet, whatever you are following, and do these holistic tools like burning, gratitude, journalism. These 3 tools she gave me in the first week, and she said to follow this." Okay, I thought, कि ठीक है, I will follow this for first week. Then again it continued for the second week also. Then I thought, what happened? She's not giving me diet chart. I asked her, keep on asking her, please give me a diet chart. I paid you for a diet chart. Okay. She asked me, okay, what happened with your mother-in-law? Like she asked me, what is your opinion now? So I told her, after 15 to 20 days, I told her, leave it about her. That is her situation and this is my situation. Now I am happy. Now I bought a good house. I have a 2 handsome child. So I don't want to talk about her. Leave it about her. And you give me a diet chart, please. So she said, please check your weight now. And I reduced 4 kgs of weight in 20 days. So I asked her, how it happened? You did not give me any diet chart. So she said, it's just because of nutrition tools. You have lost your mental weight. So she said, when I have consulted, when I have took your family history, you were always talking negative about your mother-in-law. And now you are telling me, when I asked you about your mother-in-law, you are telling me, leave it about her. I am happy now. Why you want to talk about her? So this is the magic of nutrition, holistic nutrition. So now also after almost it was 1 year, I consulted her. Now also whenever I come across any negative situation in my life, because it's a life, we come across many situations where we feel negative. So I just what I do is I remember her suggestion. Please write down the positive things and negative things about the situation. So whichever is heavier, I feel my profit is more is positive. So I feel happy. Ki theek hai, I am gaining my more of profit in positive things, not the negative things. So I feel happy in every situation. So thank you, Sandhya, for helping me out with my mental health. I am happy more about my mental health than physical health. Thank you so much.
I just want to add one point. We both are nutritionists. We both are graduates in the nutrition. We completed our MSc, BSc from the same college. But she's into business and I'm into nutrition, especially tagged with holistic nutrition. And I am great. I literally learned few points from her. Sir keeps telling every client is like a book. So I in turn learned few things from her as a coach. So we mutually learn few things from each other. Thank you. Thank you, Shweta.
Thank you, Shweta. I love the way you conveyed your experiences. That was amazing. Okay, you're confident in expressing shows your transformation as well. That's great. So next we move to our interns, and they will be sharing their H&TP experience, their learning and transformation. So I call upon Gayatri and Malati here to share their experience.
Thank you, ma'am. Good afternoon, everyone. I'm Kamakshi Gayatri. I have completed my master's in nutrition and dietetics, and right now I'm a clinical nutritionist. So I have started, now it's been almost more than 1.5 years that I have been a part of H&TP. And the change I found, it's really, amazing. Now, this is such a magical community, I could say. I started this journey when I was as a student. And before I completed my master's, I healed few people with chronic UTI, diabetes, chronic acne, and also hypothyroidism. I did this when I was a student, and right now I'm also healing few people. And when they share their experience, the change they found, it's so happy. Like now I'm handling this client who is having non-alcoholic fatty liver disease. He also has trigeminal neuralgia, has sleep disorder and weak gut. Now only 2 weeks into the guidance, what he said was his sleep cycle is regained and also his gut issues are being resolved. And when the way he expressed it, the way he said, I was so happy now. Even when I recollect it, even today, I smile ear to ear. So this kind of happiness, this is what we get. The rare magical happiness is what this holistic community gives us. And I would say, now I have come here only because the 4 main pillars into this journey, that would be firstly, Suresh sir, thank you for always being, for always guiding us. Now the fun fact is, he is a founder, but he is always there for us. Though he's so busy or what, he just picks our call and guides us. Now the second is, thank you Dhanya Irfan ma'am for believing into me and taking me as your intern. I'd say interning under Dhanya Irfan ma'am was my stepping stone into this holistic coach, into this journey. And then thank you Dhanya Lakshmi ma'am for always, holding my hand, guiding me. And Jyoti Srinivas ma'am, thank you so much for always pushing me to choose the right path, for always, being that guiding light. Thank you so much. If I was not a part of this community, I don't know what I would be doing. Thank you, H&TP family.
Hi everyone, good afternoon. This is Malati. So I completed my master's from Sarojini Naidu Vanitha Mahavidyalaya, and I'm doing as a nutritionist at NTR Trust. So before joining to the H&TP, I was a very introvert person where I had no voice for myself. Like I used to never express myself, so I was very introvert. So it's been 4 years since I have been with H&TP and H3. So during my graduation, I joined H&TP. So when I have been through this Dr. Suresh sir classes, so the Priya ma'am was the coach for me at the time. So the Suresh sir classes had changed the entire perspective of myself to the world. So when before I used to think why everything is happening to me, but after going through the classes, I got the purpose, like there is some reason that there's something I should learn. So that's why I had some experience. So. And again in my master's, I had joined the 15 days internship with H&TP, and that's where another miracle happened to me. That's where I met the H3 team, my so much loved Jyoti ma'am and Sirsha ma'am. Again I interned under Jyoti ma'am. Now I'm currently intern of Jyoti ma'am. So Sirsha ma'am was the coach for me. Then there I healed myself emotionally and I lost my weight. My overweight BMI had moved to normal. I lost 10% of body fat and gained 1% of muscle. So that's a big achievement for me. And At last time also, I had given my speech at HolistiCon, and this time I'm giving my speech at HolistiCon, and this time I didn't even prepare anything. Just ma'am said me to give my experience. So that's I'm very happy that I came here and I am able to speak. And now this is really unbelievable for me that I'm speaking in front of you, everyone. So like H&TP. And just now one incident happened with me. Like I was talking to my PG ma'am. So suddenly sir had came here and sir recognized me. I thought sir didn't know me or I may be unrecognized. But so like he's remembering every one of us. So I'm very grateful for that. That sir is care for us. So I'm very happy, sir. Thank you so much, sir. Thank you so much for this.
Okay, so sorry, I came here again. So the thing is, I missed adding this. So what happened was, I was having lunch. One of my junior approached me. I don't know who she is. She came and said, you know, you're very, very famous at the college. I was like, okay, how am I famous and all? Then she asked me, you're doing this holistic thing, right? How is it and all? Now, what I felt was getting the tag of holistic health, holistic coach gives us so much recognition. I mean, damn, that's so good. I felt so happy. I came and I shared with my friends and all. And yes, I'm sharing here now again. Yeah, so thank you.
Thank you, Gayatri and Malati. Gayatri and Malati, we have them from last year HolistiCon working sincerely towards this conference, and now they have moved a step ahead. So next we'll move on to our next case presenter. She is our special presenter who has traveled all the way from UAE to here, reached this morning to present her very special case about the nephrotic syndrome. So I would like to give a short introduction about her. She is a licensed clinical dietitian in UAE, a diabetes educator as well, a lifestyle medicine coach, and I can add on because she has so many titles behind her. And moreover, her sincerity and her dedication speaks everywhere the case she handles. So I welcome you, Sabha. Over to you.
Good afternoon. We have had a pleasant morning and a wonderful afternoon, and I'm blessed to be here today. So today I'll be talking about a case which is very close to me, and as days are passing, it is becoming closer and really very close to me. So it's about nephrotic syndrome. Now this is pediatric nephrotic syndrome. So as clinical dietitians, we do handle a lot of renal cases. But this case being special is because, So in nephrotic syndrome, the classical symptoms are hyperlipidemia, there's edema, there's frothy urine, etc. So this had classical symptoms, which the readings are here. It was a pediatric case of a boy who's in Hyderabad, basically I think Guntur, and he's only 5 years of age. Now, nephrotic syndrome in pediatric, what happens is there's a relapse often, okay? And the treatment is, the next slide. The treatment is often corticosteroid based, and most often, most of the nephrologists think that it has to have a relapse, right? So they are very clear and they know that there is going to be a relapse. And the parents also are of the mindset that there's going to be a relapse and we should be prepared every 3 months or quarterly there's a relapse. Now, this case was documented in January 2024. When it was given to me, trust me, I had spent one entire night sitting and only looking at the readings, okay? Not because how I would be handling it medically, clinically, but how holistically I'm going to make the change, yeah? So that is why I'm saying it's a very important case to me. So apart from medical nutrition therapy that we followed a renal diet, we'll come back to that. We followed a renal diet. We looked on the water, the fluid consumption the child was doing. Now, what holistic interventions are important? As holistic dietitians, as Sir has taught us, we had to sit down and had to go back to the preconception history of the mother. When the mother was pregnant with the child, when she was a child. So you understand where the root cause was there. And I had to work on his brother also. The child's name is Ayan and the brother's name is Arif. The parents were actually living in fear. Because we are pressed with time, so I cannot tell much on that, but they had so much of fear in them that they were visualizing a relapse happening every 3 months. Now you imagine a person coming from a social economic background, which is of middle class, the father's a lab technician, what consequences financially they have on the burden, right? And we don't have insurance here in India. Most of the people don't have insurance. The holistic interventions. Now these are the results. On January 24, it was presented to me. The next report is of February 24, and then March, and then again we had of May. We often follow in the corticosteroid therapy. There is often a tapering method which is used, but you see the tapering here. In February, it is 50 milligram, then 5, then 2.5, and then medications were stopped on 31st of May. He did not get a remission back. And when the remission came, it was after 5 months, and they did not need the medicines. Okay, now what holistic intervention? So one of the intervention by default is mentioned here, affirmations. Now why this affirmations here? When we talk about positive affirmation, it should come from within, right? So now the parents understand a small town in Hyderabad, they will not understand what a dietitian staying in UAE, Dubai, and they must be thinking that I have a very fancy life there. So I don't understand the struggles they are facing here. So affirmations have to come from within. So it has to come from within, from the coach also. So even if we are sitting seas apart, we have to affirm that my child, my patient will be healthy. And the mother was writing down, she was writing the affirmations. I did not make much changes in the diet plan. We did not use any renal supplement, no high protein, low protein, all these type of supplements were used because the father was willing to pay, but I did not want him to pay the extra money. Yeah. The next slide. In the first, we'll come back to the slide. Yeah. Now these are the holistic interventions that we use. So drug therapy stays there; it has to be there. The first line of treatment. Dietary changes, medical nutrition therapy is there. Lifestyle changes. Will you believe in the span of 8 years, the mother had not visited a cinema hall? Who here in India or anywhere has not visited a cinema hall after marriage? While the child was not keeping well, the husband was asked to take the mother to the cinema hall, to the garden, to spend some quality time with the mother, not the child. So this is the interventions that we were working on, and by God's grace, it helped us. Creative visualization. Now they had to visualize that the child is not falling sick. They're healthy. And not only Ayan, his brother is also healthy. Affirmations, as I mentioned. Tithing is one, it's very close to my heart. So I very strongly believe in tithing. So I asked them to do tithing. So they said, hey, we cannot spend a lot of money. So it was also 1 rupees INR. Even if he can remove 1 rupees INR per day in a small piggy bank and give it to anyone, that was enough for me. They are still practicing that, he told me when I asked him. Believe in the faith, so acceptance, right? You have to believe, and then you have to start working towards it. And gratitude. So they were constantly staying in fear, and when we back to this history, a lot of fear was there. Basically, they had to work on gratitude, which was slowly and gradually inculcated in the parents. And the result was that the child, in the previous movie, can we go back to the slide? Yeah. You see the child here, you can feel the edema here in the first picture, in the white shirt. Yeah. And this is the second picture after 3 months. So there was no edema, there was no proteinuria now, and the couple is healthy. The couple is healthy. Why? Because they're not staying in fear now. Yeah, the child is healthy. I was sure. I was 100% sure that medically we'll be helping them, but holistically I was not sure on my skills. But thanks to Dr. Suresh and the entire team of our coaches that, now we know that we can handle so many more cases holistically. Yeah, thank you.
Thank you, Sabha. So, you heard the applause. So, no words for me to tell you again about your story, your presentation. Right. So, we'll move on to the next case presenter. She is Soumya, a coach, and today she will be presenting a powerful holistic case of a 30-year-old woman diagnosed with Lichen Planus, where both the skin and the nails were severely affected, and how a structured plan of her healing has transformed her client. So over to you, Soumya.
Yeah. So good afternoon, all. So today I am here to present a case on Lichen Planus. Slides, please. Yeah. Okay. So, and how holistic tools have helped my client to overcome this condition and healing herself inside out. Next slide. Okay, my client happens to be a 30-year-old woman who was suffering from lichen planus, which was affecting her skin, nails, and along with that, she was also having anxiety issues, depression, and insomnia. Right? It took us almost 6 months of solid holistic interventions to help her, bring to a normal state. So, what is lichen planus? It is a chronic inflammatory condition of skin. It also affects nails, hair, and the mucous membranes. When we were trying to approach, the holistic approach, the way we follow, we go to the history of the person. So when we were uncovering what was her fears, because she was always complaining that she may die at any time. She was holding unnecessary fears about herself. When we have asked her what exactly is causing you all these fears, right? It all went back to her childhood, where she had to face physical abuse in the form of groping, which she didn't like at all, followed by a lot of blaming and all that. She was holding back so much, right? So what are the tools that we have applied for our coach? These are very simple tools like breath work and affirmations. So breathwork is a conscious practice of, breathing, which has helped her to calm her nervous system down and to feel safe in her body. And affirmations, because she always, complained about there is always a negative chatter. She used to say that my mind is my biggest enemy. I can't run away from it. So constant affirmations have put the faith back into her, right? So we have kept her like simple routine like sun gazing, dance and movement, and eating antioxidant rich food has literally helped her to come out of this condition. Next slide. So there is a very beautiful lesson here from this case that we all can learn. See, most of the habits that we develop as elders, it always comes from the childhood, isn't it? So I think most of the people might have heard that I don't like curd. I don't like curd rice, I don't like brinjal and all such sort of things, isn't it? So for her also, the condition which she is facing now, it roots back to her childhood only. So here what her skin was trying to, it was literally trying to talk to her. When the voice has been silenced and the boundaries have been crossed many a times, the skin has become the messenger. Here the inflammation was not the enemy, but it was trying to protect her, saying, I don't want to be touched. Please maintain a distance, kind of a thing. See, what happens is whenever there is a skin condition, people, they just don't want to come close to them. It is her way of saying that I need to feel safe. So that's a very beautiful learning that I had from this client. So what follows is the pictures. So holistic healing has literally reinforced my belief that true healing begins when we treat the person, not just the disease alone. Thank you so much for giving me the opportunity. Thank you.
Thank you, Soumya. We have our next presenter on stage, Mrs. Swapna Rajaram. And she will be presenting a case on a varicose vein. Yeah, over to you.
Thank you, Kavita, and very good afternoon to everyone. Okay, so from HS to relief. So during 6 weeks, I worked with 6 clients, aged between 34 and 47, both male and female, presenting with varicose veins. And this was a 30-day intervention, and it focused not just on the symptom relief, but on holistic wellness. So generally, varicose veins means we treat only the localized, the venous congestion. But what we miss is something else. So in this case, luckily, the clients, they didn't have any other comorbidities. So what could be the reason? The question arises now. So when the structure alone is not the cause, what else could be the cause? So what happened? Next we will see what happened after the 6 weeks. So before starting, during those initial intervention periods, it was found through age regression and proper analysis. There was imbalance in grounding and root chakra. So after counseling, after telling, it was found that there was a lot of emotional blockages. Like for some, it was a constrained relationship. For some, it was the resistance to take up leadership. And for one, it was the unresolved grief due to a miscarriage. And for one, it was unresolved childhood trauma. And for one, a Muslim lady, it was the fear of life due to financial crisis. And for another, it was just a fall. And because of that fall, she started fearing to walk. She was literally bedridden. So these were the 6 root causes for all these 6 clients. So what happened after 6 weeks? Their result was very profound. Before they even feared to walk, do their daily routine, but after 6 weeks, they started to walk. They showed improvement in their symptoms, and they started squatting, climbing stairs very easily, and then apart from that, the most important thing was the emotional balance. They started feeling secure within. So next, how did this happen? So I took both the nutrition and holistic approach. In the nutritional approach, the water intake, during counseling, during talking with them, it was found that their hydration level was pretty poor. So the water intake was increased. Then anti-inflammatory spices, herbs, they were included so that it improved the circulation. For fiber, fruits and vegetable intake were increased, and depending on the food group decrease, that particular food group was made to increase. And when it comes to holistic approaches, yoga and pranayama, it was done daily from Monday to Friday, and these 2 things improved their movement and nervous system. And the LUM meditation, which is more for the root chakra, that and the burning practices, gratitude and affirmations, they helped in emotional balance. So what at the last, what it was found that when the stagnation releases, the movement starts. Because when we start moving forward internally, the body follows with great enthusiasm. Thank you.
Thank you, Swapna. So we have been listening to continuous shots on the case study, and we have a final shot from Nikita. So to give an intro about Nikita, she is a graduate, have done a master's in nutrition, and is currently working as a clinical dietitian in Yashoda Hospital. And today she will be talking about her PCOD reversal case. Over to you, Nikita.
Good afternoon, everyone. So today I would like to share a powerful healing journey that truly changed the way of understanding emotions and self-healing. This case is a story of a 23 years old student who is currently pursuing a master's in nutrition. So she came up with a history of severe menstrual irregularities since puberty. From the age of 12, she had extremely menstrual irregularities and the flow would last for 20 to 30 days. And the cycle length was 2 to 3 times a year. And she was accompanied with severe pain, weakness, and complete disruption of her social life. Because of the heavy flow, she used to skip her college straight away for 30 days. Just lie down completely, do nothing, and she used to feel so helpless. But as we explored the case deeper, the imbalance was not just physical. At the age of 17, during her intermediate years, she was in a relationship and was on a good terms. But she carried a secret, and that secret made a whole emotional world. These days, if you're not into any relationship, you're not considered into the social circle. So she, because of the peer pressure, fear of the emotional attachment, judgments passed, she came up with a story that she donated a kidney to her relative. And that lie was carried till now, until the program. So it became a shield. It was her identity that a sympathy, respect was given, that no one would approach her for any kind of relationships. But that one lie turned into deeper guilt, emotional withdrawal, and constant stress. Her body was carrying something her heart never expressed. Next slide. So the outcomes were remarkable. Since the age of 12 years, she used to take 21 days medication course. But after the program and during the 108 days journey, she got her natural menses for the first time in the 12 years without popping a single medicine. All the pains were disappeared and her energy levels were so significantly changed that she could do 45 minutes of cardio on the day of her periods. Previously, her flow was 20 to 30 days, but now it is a healthy flow of 3 to 4 days. And the relationship with the food became balanced, her confidence improved, and most importantly, she forgave herself and released all the years of guilt. And how did we achieve this? She slowly developed awareness to her body and the emotions through lifestyle realignment, mindful nutrition, regular physical activity, journaling, gratitude, and most importantly, self-forgiveness letter. She forgave herself for not knowing better at that time. She thought what was right to protect her emotions. So self-forgiveness letter is not about forgetting the mistake. It's about accepting it and choosing the peace. She chose the peace, all her stress levels were reduced, and emotional burden began to release. Then the nervous system got calm. This case heartfully reminds us that when awareness replaces fear, compassion replaces suppression, the body responds. Because emotions heal and the hormones follow. Thank you.
Hello. Thank you, Nikita, for the wonderful presentation. So next we move on to the panel discussion. So let's wait for a minute for the stage arrangement and we'll start. All the case presentations, one after the other, bullets being coming from the guns. So it is We still more have loadings happening, but it will be too much tiring at the same day. So we still have more cases coming up later. So now we'll get into the panel discussion. So here, the topic for the today panel discussion is, can chronic disease really be reversed? Traditionally, chronic diseases have been managed, not healed. But growing clinical experience and lifestyle science are shifting the conversation from symptom control to addressing root causes. This discussion is not about miracles, but about possibilities, responsibilities, and collaborations, where modern medicine meets lifestyle, nutrition, and patient participation. To bring diverse and grounded perspectives, we have the eminent panel discussion doctors over here with multiple specialties. So now I invite Dr. Shyam on the stage. Please take your seat, sir. So Dr. Shyam is an endocrinologist and a diabetologist practicing and the founder of Idea Clinics. And I invite Dr. Shravanti. Please give a big round of applause. Right doctors for holistic approach. So Dr. Shravanti is a gynecologist and a laparoscopic surgeon. Thank you, ma'am. And I invite Dr. Harinath, orthopedic surgeon from Apollo Hospitals, and Dr. Pavan Kumar, pediatrician, who is associated with Omega Clinics. And I invite our two moderators, Revati Prasad and Jyoti Srinivas. So before I hand it over to the moderators, we now have a truly multidisciplinary panel on stage, each representing a different chapter of human health, from childhood to adulthood, from acute care to long-term disease management. Rather than debating alternative various modern medicines, today discuss focuses on integration, patient accountability, and long-term outcomes. I now invite our moderators to take it up and proceed from here.
Thank you, Danya.
Good afternoon, all. We have mentioned that there will be a gastroenterologist and a cardiologist also. And unfortunately, Dr. Kiran Peddi, our gastroenterologist from the panel, is not able to make it because of a family commitment, a last-minute family commitment. And Dr. Sharath is stuck in a meeting. He may join us at any time. So nevertheless, we'll continue with the panel.
Thank you, sir. So thank you everyone for joining us today. A warm welcome to everyone. We are really grateful for sharing your valuable time with all of us. So I'll just give a glance of what we are going to do today, the topic for our panel discussion. So today we are talking a lot about something that many families live with every day, chronic health problems like diabetes, heart diseases, gut issues, hormonal imbalances, joint pains, and long-term fatigue, and becoming increasingly common even among the younger generations. Most of us grow up believing that once these problems begin, they must be managed for the life with medicines, tests, and regular follow-ups. Yet, in everyday clinical practice, doctors are also noticing something else. When appropriate medical treatment is supported by changes in food, sleep, stress management, movement, and daily habits, many patients experience meaningful improvement, especially when these changes are made early. So this discussion today is not about making up any promises or any bold claims, but it is about understanding from the experienced doctors across specialties that we have today that what improvement truly looks like, what is possible for whom, and how medical science understands these changes. So we invite you all to listen with an open mind, reflect on your own experiences or your family's journey, and let this conversation grow through clinical insight and real life stories. So also, sir, along with the audience, we also have collected a few thoughtful questions from our holistic coaches who really wanted to come up and discuss certain aspects of your specialties with you all. So we'll bring them in between. So thank you all for joining us today. So to start the panel discussion, the topic for today is how do we address the chronic disease burden? So as the topic is very clear, so we'll start with this one simple question with all the specialty doctors. I request you all to take a moment, think about it, and just let us share your views on it. That many families here live with someone who has a long-standing health problem. From what you see in your practice, how much can these conditions improve with the right medical care combined with lifestyle changes?
Thank you. Thank you all. Thanks, Suresh, for inviting us today. So, you are right. The whole health industry is changing. There is a paradigm shift in how health is delivered. If you see today, we are looking healthcare from specialties. There is a pediatrician, orthopedician, gynecologist. I think this is going to change to condition-based care. PCOD is a condition which involves gynecologists, nutritionists, dietitians, psychologists, endocrinologists. So chronic diseases has to have holistic viewpoint. I think that's how we are heading. When you look at health conditions, they are either syndromic conditions or distinct conditions. By that I mean, for example, type 1 diabetes is a distinct entity. Down syndrome is a distinct entity. Whereas PCOS, diabetes, type 2 diabetes, obesity, all these are syndromic. They involve multi-specialty, lifestyle, lot of factors which we discussed today. So I think the way we approach healthcare has to change. It is changing. And one of the ways is the Suresh's approach to holistic medicine. Thank you.
Very good afternoon to all. Thank you very much, Suresh sir, for the great opportunity. So, as a gynecologist, if you won't feel bad, chronic diseases are boon for us. For example, PCOS, they will come for 10 years, 20 years, always coming for the treatment. Not only the mother, followed by the daughter-in-laws, daughters. So chronic diseases are like ever-ending story. That is called chronic. So they will not give a good relief with one-time medicine. So now why we are going with the holistic approach means, so how to monitor this? Because these people are lifelong, they are having various discomfort places like endometriosis, adenomyosis, you are hearing PCOS, then vulval problems means itching, vaginal itching, and other very cancers, vaginal cancers, ovarian cancers, or CA cervical cancers. These things are like a chronic. So they will be there with you lifelong. So how to come out? There is not a one time or one shot treatment is not there for all these chronic diseases. So you need multidisciplinary here. So we need definitely counselors, not only the medicine, counselors. When people come to me with PCOS, I'll give a lot of nutrition and dietary changes, and I'll not give medicine. They will tell, what ma'am, you are not an allopathic doctor? You are telling like a naturopathy doctor. Means I'll tell, see, first I am a human being. I know, see, nature has given. We have lot of, like even our mud is having lot of values. So that's why first we have to be like a human being. Afterwards only allopathy will come. So most of the things are at our home. At home, lot of medicine is there. What we are doing from Puratana Kalam, we have to say Puratana Kalam. So that's why I like lot of these dietary and exercise changes rather than giving lot of medicine. Especially 90% of girls are suffering with PCOS. Not only girls, women and whatever the age. So those people, better to be with naturopathy doctor rather than allopathy doctor, what I am feeling. So my thesis also PCOS, PhD also PCOS, extraordinary recovery with this dietary, exercise and stress management.
Yeah.
No? Okay. Suresh?
Hello. Thank you, Dr. Suresh, for giving me such a wonderful opportunity to be part of this holistic nutritional panel discussion. Being an orthopedic surgeon, I do come across with a lot of chronic diseases. Most of the time, chronic patients are bread and butter of orthopedic surgeon. If I do any surgery, he is going to stay with me at least for 3 weeks, 3 weeks to 3 months, 6 months, sometimes some years also. Whenever we deal, once surgery is completed, next comes the nutritional part and emotional part also. When we can't assure each and every patient 100% recovery. Sometimes there is going to be some deformities, limpings, especially associated with the pediatric patients. So family has to be treated. As rightly said, it is always not only the disease, it should be treated. It is the family, and as a person, it should be a holistic, nutritional as well as meditation sometimes, especially in recovery phases. We do a lot of physiotherapy, yoga, and sometimes meditation also, especially in dealing with rheumatoid arthritis, any chronic patients. Meditation will heal, definitely. I do believe that. A holistic approach is a good one, and it has got a lot of scope in coming future. Thank you very much.
Yeah, thank you. Thank you, holistic team, holistic nutrition team. Thank you, Dr. Suresh. So I would like to start with a question. Like, do you know when all these chronic diseases, what we are being spoken all the day, do you know when they originate? Anybody? Where they originate? From where? Where is the root? No, where all these chronic diseases originate, like hypertension, diabetes, stroke, and cardiovascular disease, when they originate first? From where? No, which part of? Yeah. I think, yeah. It's not just childhood, it's in utero. We have a gynecologist, I think she's my colleague in the first 1,000 days, what we speak about. So all these have a root cause, the origin in the womb itself, in utero. So there is a famous Chinese story where, there was a riverside village. So these villagers, when they go to river, they used to see many people who have fallen into the river and they were, drowning in that and dying. So it is the routine scene for these villagers. But one guy, what he thought, let me save some people at least. So he used to go in the sunrise till sunset. How many people he used to catch hold? He used to pull them up and he used to save them. He thought that at least that person, it makes difference to that person. So similarly, it's like after some time, there are other villagers who have with similar mentality. They also came and joined with his force. So every day, this youth gang used to go and save as many people as come. Suppose there are 100 people who are drowning, they could able to save only 10 around like that. Okay, one day the first person who has started this program, he disappeared from the village. So when he went, nobody did, but these people thought that maybe he got burnout. He couldn't save so many people. So what he did, what the other people, they continued saving the people. After some time, the people who are coming around like around 100 per day, slowly it was being decreased to 50, 40, 30, 10. After some time, there was no one who is coming drowned there. So after few months, again during the village festival, this guy came back, the one who has started, right? So he has come back. So these people went to him and, do you know the surprise? All these years, so many people were, getting drowned and, dying here. But for the past 3-4 months, nobody was coming. Nobody was dying in the river. Then this guy says, I know. They were shocked. How do you know that, these people? Because what he says is, I went upstream and have closed all the places where these people are falling into the river. So that is called going upstream. So we are discussing about diabetes, hypertension and all these changes now. So it's like, almost out of 10%, 10 to 14% of the people in India, they are diabetic. And if you take 4 risk factors, obesity, hypertension, and sedentary lifestyle, and your eating patterns. If these 4, if you have checked them, 85% of the people that turn out to be diabetic. The detection rate in these 4 risk factors people is 85%. Okay? So if you want to go and solve the problem forever, where we have to go? Where we have to start the program? Right from the womb, right? So that is called going upstream. So we are very fortunate that we are working now on that thing, where in utero, from the utero and first 1,000 days, that is called, right from conception to first 2 years of life. If we really program, if we really cut that, like that hero, we can also save this over the period, we can see the cutting down of that. So definitely, ma'am, lifestyle factors, what is that genes, that epigenetic factors, what they say, that is 80%. And do you know what is that 80% which will decide the genes to get expressed or suppressed? Is these lifestyle factors like nutrition, your physical exercise, the way you sleep, the duration, everything. These matters a lot. So I agree with that. The lifestyle medicine now has come as a big branch. I'm a student of this American board certified lifestyle medicine. So I was thinking, they are no more like a ancillary, apart from ancillary treatment. They are the main treatment itself. That is called therapeutic lifestyle interventions. So they have proved that diabetic can be reversed. Heart diseases can be reversed by 6 pillars. Can anybody tell 6 pillars? 6 pillars of lifestyle medicine? Can raise your hand and tell 6 pillars, you will get some gift. Suresh is generous enough to give gifts today. So anybody? 6 pillars. If you just take care of the 6 pillars, that is finding the root cause, the person who has went. So you can solve that right from, if you inculcate that habits right from the childhood itself, you can solve most of these diseases to come into the mainstream. Like that, we can slowly cut down number of people becoming diabetic, hypertensive, coronary heart disease, right when you correct the root cause. Thank you.
Thank you, sir. That was wonderful. So I'll pass it on to you, Revati.
So again, on my behalf, I welcome you, all of you, sir, ma'am. Thank you so much for being here. So now I would like to ask a question to Dr. Shyam, sir. So we see ongoing stress and poor sleep, on a longer run, it is actually affecting the overall life, right? And over time, they also disturb hormones, sugar controls, and metabolism. So now what we would like to know here is, in long term, hormone-related problems like diabetes or thyroid, what does real progress mean to you? Better day-to-day control, avoiding stronger medicines, or delaying future complications?
So your question is, what exactly is the outcome of these conditions? Is that what you wanted to know? Or?
No, my question is, what decides you that, okay, this is the real progress in my patient, whether you are decreasing the dosage, or is that avoiding the stronger, the combination of medicines, or it is like delaying the future complication? As a clinician, how do you see or assess your progress sheet of your patient?
Yeah. So the question now is, what exactly should we be looking at? For example, if there is a patient with diabetes. So end of the day, this whole healthcare is about 2 things. We have one life on this planet. How long are we going to live, which we call longevity, and how healthy are we going to live? So both quality and quantity of life. So when we treat our patients with diabetes, the question is, you know how much life expectancy is reduced if you get diabetes in your 30s? Can anybody guess? How many years of life are we going to lose if we become diabetic in our 30s? Sorry? What is 50? 50? 10 years. Yeah. No, 10 years is. So if you become diabetic in your 30s, you may lose 10 years of your life. So that is called premature deaths. So the question now is, when we look at quantity of life, so you know what percentage of our population are becoming diabetics in your 30s? You know, in our clinics, see, when we worked abroad, diabetes is a condition for elderly. We used to see patients above 50, 60, 70 who used to come with diabetes. In India, the problem we have is the elderly population are healthy. It's the youth, particularly below 40. I think 30% of our patients are below age 40. So these are the people, if you don't address adequately, so there are three choices these patients are left with. One is called lifestyle, which is called holistic, whether it's sleep, diet, exercise, weight, mind, body, all this is lifestyle. That is one option. The option two is medications. Now you are hearing a lot about GLP-1 therapies, all these Ozempics, Mounjaros. That is option two. Option three we should avoid is getting to hospitals. These people work in hospitals, getting your repair work, having a stent or a bypass, dialysis or a transplant. So in that regard, holistic medicine is a way forward, we all agree. So the whole intention of treating diabetes or whatever lifestyle condition is, how can we extend that person's life and how can we keep that patient outside hospital bed? As long as we don't let our people go into hospital bed, I think we are successful.
Thank you so much, sir. So I would like to now I would like to have a question from our fellow coaches. So I wish to have the question from Viji. Check.
Hello sir, myself Vijay. So many people have gut issues and like stomach problem, gas, bloating or any digestive issues before they told they are diabetes. So do you see this as an early sign of diabetes or metabolic issues?
Gut is the biggest endocrine organ. This is something which is popping up now quite commonly. There are both gut hormones and gut bacteria. There are two aspects of gut. Gut hormones, we are hearing incretin hormones, all this variety of hormones, GLP-1s, ghrelins. Ghrelin is called hunger hormone. So ghrelin is released from the stomach. So that controls how hungry we are. GLP-1 and PYY and GIP, they are all satiety hormones. So that is one interesting area. The much more interesting is gut microbiomes, gut bacteria. This is completely paradigm shift in how our health is controlled by gut. Like in olden days, we used to come across some patients who used to say, after my appendix surgery, I put on weight. After my gallbladder surgery, I put on weight. After delivery of my first child, I put on weight. We never used to understand why. Now we understand that the milieu of gut bacteria, whether we give unnecessary antibiotics, I don't know, is the food toxins we consume, all this glycated food, we consume, and we consume almost 10 grams of plastic each week. That's equivalent to a credit card. That's amount of toxins we are consuming. So gut is the most important organ. I think the future health is related to that. we are seeing the starting of that in terms of GLP therapy. The GLP therapy is the next PPI, proton pump. The way pantoprazoles and omeprazoles got rid of general surgeons doing surgeries for, peptic ulcers, GLP-1 therapy is going to be the next thing that we all are watching forward. Lot of molecules will come in this direction which are addressing gut.
Right, sir. Thank you, Vijay. And next question we have from Swapna regarding thyroid, sir.
Good evening, sir. So I have seen 2 or 3 clients of mine who, in spite of taking the thyroid tablets, the dosages correctly, their biochemical parameters keep varying. I would like to know if the dosages they're taking duration, their lifestyle or stress or any other nutrients that play a major role other than the iodine in this factor.
So thyroid, again, the way I explained type 1 diabetes and type 2 diabetes, there are 2 aspects of thyroid we need to handle. One is much more common called subclinical hypothyroid. Subclinical hypothyroid, every 1 in 10 or 1 in 2 in 10 will have borderline TSHs. In fact, when you put on weight, TSH also goes up. When you put on in obese subjects, the cortisol and the TSH is slightly elevated. So there are 2 types of hypothyroidism. One is Hashimoto's, which is predominantly where TSH is extremely high. TSH will be hundreds. So that is a genuine, that's like equivalent to type 1 diabetes. There is no gray area. Type 1, either you are yes or no. So there are overt hypothyroid, in which case there is nothing else we can do apart from replacing thyroid treatment. However, the subclinical hypothyroid, I think we should resist ourselves from unnecessarily subjecting those patients to medications. We should look at nutrition, lifestyle. That's where holistic medicine comes to play. We need to look at, there are areas beyond just giving some thyroxine replacement.
Since the values vary, though the medication is taken regularly, like when you take from the general person's perspective, sir, as a common person's perspective, they think that, yeah, we are on the medication right as given, but the values are shifting. So how do we take this message to the crowd?
See, there is lot of myths and anxieties around thyroid. The thyroid levels fluctuation, like if you take one blood sample and send to 10 different labs, one may give TSH of 5, the other will give 6 or 7. See, those are not variations, those are normal. Human body is not constant. We are not, 2 plus 2 is never 4 in human body. Our mind, our pulse, our blood pressure, our thoughts, our hunger, everything is in a dynamic process. So let's not get worried about subtle fluctuations. There are 3 predominant reasons for thyroid levels to fluctuate. One is, most common reason in India is compliance. People forget taking their tablets. If you ask them, they would have forgotten in the last 30 days. So if you forget for 3-4 days, your TSH is bound to fluctuate. So the biggest reason is missing medication. Second, the problem with thyroid replacement is, unfortunately, when you take your tablet, if you eat or drink within 1 hour, the absorption is reduced drastically. So avoid milk and other medications, food. You can have water, but rest of the things, there should be a gap. So most of our patients, these are the 2 tricky areas. Sometimes due to various reasons, putting on weight, other factors might influence. So by and large, people get scared when TSH fluctuates by 1 or 2 points here and there. That is not a significant thing that we should be worried about.
As you rightly said, many patients, they forget taking the medicine. So rightly said. But the problem that we see as a holistic coaches, when we get into their lives, they say since they forget the medicine, the day progresses accordingly. Everything is delayed. So how do we actually bring up the shift in practice? Like if, yes, forgetting medicine is happening and absorption is affecting, but how do we practically bring up the change? How do we educate our general public that how they can take on time and so that everything falls in place? Because everything is becoming chaotic since they're forgetting.
See, there is lot of anxiety. I think thyroid, they should be more worried about better things in life than worried about thyroid. Thyroid should be like a brushing habit. Let's not make it a center stage of your life. Most people blame thyroid for their obesity. Thyroid hardly causes couple of kgs weight gain. It doesn't shift so much weight. So they blame their thyroid. There is a lot of awareness lacking. They put thyroid as a very big, next to cancer. I think diabetes is more scarier than thyroid. So in terms of, how long will it take when you consume a thyroid tablet? How long does it take to work? What's the half-life of a thyroid tablet? Can you guess? When you take a tablet, how long will it take to start working? 1 week. So there is a myth. Some people take that they say that they took thyroid tablet and within half an hour something changed in their body or they got. So this is the mind problem. That's where holistic medicine with right. So thyroid half-life is 1 week. So if you take tablet within 1 day, you won't see any change. So in terms of compliance, don't forget your tablet. You can take any time as long as stomach is empty, whether you take morning 6 o'clock or morning 10 o'clock or whatever time you take, stomach should be empty because absorption is a problem. Second thing, once you consume the tablet, you should give 1 hour gap in terms of having rest of the food.
Thank you so much, sir. So now, ma'am, question to you. So hormonal and metabolic imbalance is often first felt in women through changes in their menstrual cycle, even when report looks normal. So I would like to know, many women have normal reports. So we coaches have seen the reports are normal, the scan reports are normal, but still they explain their symptom of irregular menses. So how do you explain this in your day-to-day practice?
This is the thing where we are we have to compare. See, in olden days, there are no blood tests, no hormonal profile, nothing, no. So everything will be symptomatic. Patient symptomatic approach is very important. As a clinicians, we will ask questions. They'll tell, we are forwarding reports to the WhatsApp. What I have to do with the reports in the WhatsApp? I have to see you. Because I have to talk to you. What exactly happening to you? Because these reports are only to support. That is not the diagnostic criteria. Reports are not at all. Because once symptoms come, they have to take lot of time to come into the blood test or urine test or scan. So these are the stages will be there for everything. So now the people are fond of always coming and asking for the blood test and USG abdomen or scan, something. Even they are ready to go for the MRI without seeing a doctor. So that is the thing where we are giving counseling part. So whenever the people come and they will say same thing, my reports are normal, but I am feeling, so who said with the normal reports you will not have disease? With normal reports you will have disease. How can you say the disease will be correlated always with these reports? No, not at all. So things are like hormonal imbalance, whatever you are seeing in PCOS or any menstrual irregularities, we have only 4 hormones to study. They will not give whole picture. So first of all, you have to talk with us. So how you have started, how it happened, how many days is flowing, how many parts you are changing. These are the things which will take us to a proper diagnosis. Please don't go along with this thing, because mostly even though your irregular periods or something is happening, the hormones are normal. Like stage 3 or stage 4 means in worst cases only, like if for suppose prolactin will be normal in almost 80% of PCOS. Only few PCOS people will have increased prolactin or increased testosterone. Very few, means they are in advanced. In early stages, there will not be any changes in the blood. So that's why you have to go to a doctor when you having some abnormality. This is called early diagnosis. Don't go for the late diagnosis. Means you will think it's okay, it is normal. We will see for another month. We will see for 6 months. We will see for, and you will you will chat with your friends or your neighbors, and they will tell whatever they have the half knowledge. So they will tell you it is okay, Ray, don't worry. Doctor, if go to a doctor, she will charge 500, she will charge 5,000 for blood test, and she will give 20 medicine unnecessary. See, of course, that is, even I agree, some of the people will do, some doctors are doing that, but at least one reliable doctor, we are there, at least some reliable doctors are there in the society. So at least one visit when you have some abnormality. Don't expect blood test will give all the information.
Ma'am, I'm so glad that at least people say the reports are normal. We don't have to go to doctor. That is definitely alarming. But at the same time, we also see the contrast. They say like, okay, there is some symptom, but everything is normal now. There is nothing abnormal. They are even bothered about that as well. You know, when they see a normal report also, they are not happy. So to that context, what I would like to know is, the body has a different way of showing up symptoms. It could be structural, functional, biochemical. But what we see in our practices is, it is more functional. Not, see, as the context to the first question, the follow-up question, normal report, there is no change in the structure of the organ. The biochemical parameter is normal. Probably we are more seeing like functional. The function is not happening. So how do you explain to your patient, you know, in your clinical setup, you see a lot of patients. So how do you go about it?
So that's what my approach is always. First, I'll talk to the patient. I'll at least, new patient means I will take at least 15 to 20 minutes clinically and taking history. I don't like to give any prescription or any advice for the blood test. First, I'll take lot of information, including family history, including sirs told like from the uterus, females, lot of things starts from the uterus. For females more, because what type of medication that mother took and what of exposures she made. So that's why from the, now you are seeing pubertal. Puberty is coming at 9 years. Before, after 12 years. This is called premature puberty. This is starting from the uterus, problem starting from the uterus. So, we will counsel. So, this is related to this. This is related to this. No hurry for the blood test, no hurry for the medication. First, understand your disease. This is abnormal. Some people are like two extremities. Some people with lot of problems, they will sit and, okay, we will see. Some people with mild change, they will rush to the doctor. These two type of extremities are stressful. These two are very bad. So you should be like managed. Okay, calm down. First you have to tell to your body, to your mind, okay, let me settle down. First I have to think myself and let discuss with the doctor. So those two are very, very dangerous. Some people, as you said, they will tell that so something is happening, it's normal. Because they are telling themselves, so that is like bahana. So they don't want to see the doctor. If you go to the doctor, what will she tell? Main thing is cancer. She will tell me, तुमको cancer है. वो डर से नहीं जाते पहले. So not like that. No, cancers are my 0.1% cancers. So no worries. At least for gynecologist, cancer rate is not that much except for the cervical cancer. Cervical cancer is now, it is one of the, every 8 minutes woman is dying. So we are bothered about cervical cancer. So that's why we are giving counseling for the pap smears, screening, and of course vaccination. Except for that, these menstrual irregularities and heavy bleeding, pain abdomen, sexual problems, no need to worry. We have lot of medications and simple advices, like what type of diet, what type of exercise you have to do, and what are the things you have to take care, like how to manage the stress, how to avoid the mobiles. These small, like the nutritionist will giving what type of diet you have to take, and she will also tell some physiotherapy. These are the things you have to take care. But don't neglect. So early diagnosis is very, very important.
Thank you so much.
this question is regarding the vaccination. It can go to you also, sir, Dr. Pawan sir, and you, ma'am. So we keep hearing like all the young girls, especially with the cervical cancer incidences that are happening these days, it is insisted to take the HPV vaccine a lot, and the 2 doses if it is before 11 or if not 3. So how should we take this? Should every single girl should go through this vaccination? What is your suggestion on this for the general public? Sir, I would like to hear from you too, sir.
Yes, now cervical cancer is now we have added in a protocol, like WHO guidelines are there. So not only girls, boys also they have to take the HPV vaccine. They are thinking that cervical cancer only it is means prevention by the HPV vaccine. No, boys also. So 9 to 40 years we are recommending HPV vaccine. 9 years to 15 years 2 doses, and after 15 to 40 years 3 doses. HPV vaccine, there are 2 types are there. One is quadrivalent, one is nanovalent. So you have to better when before sexual activity, means before marriage. Before sexual activity means you are not you are not exposed to the virus. So the coverage means the success rate or sensitivity will be very high when it started early. Boys also have to take same dosage, same the 2 companies are giving this, Gardasil and Cervarix. So anything is okay, but it is not like a free of cost. Government is not providing, but few like some NGOs are giving in a 50%. If anybody interested, I'll let you know. If you want to go, Ramakrishna Math, they are giving also for the 50%, but it is mandatory. It is like no side effects. A lot of people are thinking that these HPV vaccine is having side effects, and they are telling some people have died or some people developed some thrombosis like that. But it is wrong. It may be coincidence. Happily you can take, and I'll recommend every mother, they have to educate and take the boy or girl for the vaccination.
Thank you, ma'am. So.
Yeah, it is extremely important. How many of you remember the recent Ahmedabad flight crash? Raise your hands. Yeah, it has just taken off. Within minutes, it has crashed, right? So it's like, no, like how many people who have died in that crash every day? It's like because of cervical cancer, it is equal to that Boeing flight crashed every day. Imagine every day there is a Ahmedabad, like, you know, that Air India flight, Boeing flight, it is getting crashed everywhere. Those many people, women, are dying because of cervical cancer. And the first largest cancer in India is breast cancer, which is mostly genetic most of the times, and we can't prevent it, right? And what is the second largest cancer, do you know? Second largest cancer for which in MNJ Cancer Institute, Indo-American cancer, people lining up for chemotherapy, radiotherapy, not one person, but the entire family is suffering. So do you know what is that? Cervical cancer. Okay? Cervical cancer, after breast cancer, second is cervical cancer. Do you know, for cervical cancer to form like that, there need to be a virus. Without this virus, the cervix, you won't find the cancer changes in the cervix. So which is that virus? This virus should be there to get the woman to get that cancer. So what is that virus? HPV virus, which is human papilloma virus. That should be there. Suppose if you eliminate that entering your body, if you have already antibodies protecting against that virus, that cancer won't come. How great it is, right? How great. You can just prevent a cancer just by taking a vaccine, so that you are eliminating the infection, and that infection which is necessary to convert into cancer, that you are eliminating chances. How great, how miraculous. And the protection is almost 98.3%. From where you get that protection? So how many of you have taken HPV cancer vaccine? Cancer prevention vaccine? Yeah, I think I see a few hands going up, but I request all of you women here. Okay? Yeah, very good. You can also take, ma'am. Now 45 years they have given. Now you can, the recent guidelines says up to 45 years. Yes, take it. No harm in taking it. But you know that 100% of protection may go down. But you know, as rightly said, it is mandatory for every woman. Please take it. And if you have a kids, you know, what is the best time to take it? 9 years. After completion of 9 years. Suppose if you take it 15 years, which requires 3 doses. 3 doses means 1 dose you have to spend extra. So that money if you want to save, get that vaccine between 9 to 14 years. 2 doses are enough with a span of 6 months. And the study says that if you give, some people will ask me, why so early, 9 years only, why you want to give that vaccine like that? So do you know what is the protection level when you give it 9 years and between give 15 years? Here it is 87%, here it is almost 65%. So which one you choose? So start early, give early, protect our next generation women, your sisters, your daughters, your spouses, protect them with cervical cancer vaccine.
Thank you, sir.
So next, we will have a question from our coach, Ms. Dania Irfan, to Shravanti ma'am.
Hello, ma'am. So my question to you is that today women take a lot of birth control pills for regularizing their periods, and still they have irregular or whatever, heavy bleeding and all that. So at what point do you think it becomes a cause of concern? And when should all this be reviewed, the medications and all be reviewed?
See, nowadays I am seeing even small girls like 7 years, 8 years, girls are coming with a lot of white discharge. And by 9 years, they are getting the period. So it is like going like a heavy flow, or it is not giving, like amenorrhea, what we'll call it as not getting period. 2 months, 3 months, they are not getting the period. So these are two things which we are regularly coming across. This is called, if it is heavy bleeding, we'll call it as pubertal menorrhagia. Means in puberty, there will be some, now hormones are now it is coming out and they have to come in alignment. So that may take some days, like 1 or 2 years to align. So no need to worry. When you have to worry means if it is flowing heavy, because you are losing blood. Everybody will think it is a bad blood. There is nothing like bad blood, no. So you have to educate that. You have to go to your doctor if it is heavy bleeding. Means if every month you should get 3 to 6 days bleeding, and every 28 days, this is the cycle. If it is going either or other, definitely you have some problem with your hormones or any functional problem or any structural problem. So when you are coming to the doctor, immediately don't rush into the treatment, because it is a teenager, she may need some more days. So when any girl, like any teenager come to me, I will give first counseling. So for observation until you need to take some time, until at least for 18 to 19 years. So meanwhile, you have to change her lifestyle. Means dietary changes, exercises. Nowadays, what is the main problem is diet and exercises. Nobody are doing exercises. Previously, we used to go to the school, even though we have cars, we used to go to the school in cycle or by walk. So some type of exercise, and also definitely some physical activity. PD sir will be there. So every school or every day 1 hour for the sports we used to have. But no, now all sedentary lifestyle. Read, get the rank. So the problem is with the parents. I can say parents are the first I have to blame, not the children. And nowadays, after 20th century, mobiles are the main culprit. So everything with the mobile. So radiation. So these are the two things we have to change. Of course, important thing as a nutritionist, junk food. Avoid the junk food. So nowadays, lot of maida they are consuming. So that you have to avoid. These three things, and of course, definitely timely. Means they are not taking timely. Like midnight they are taking. So 12 o'clock, 1 o'clock, biryanis, all these you have to change, definitely. And important thing is what I told from last 10 years, I am insisting on stress management. So don't you are telling like pillalu always chadu, getting rank, comparing with others. And they are like stressed out. And they are not able to give their inner things. Means maybe they don't want that subject. Even though I am a doctor, I never forced my children to go as a doctor, because they are having some other talent. So always you have to give some time, and you try to change these things. Normal, these things means lifestyle. So dietary changes, what you can do as a mother, you have to ask, so what type of diet she can have. Means you cannot force eat this only. And if any period problem, then ask doctor what to do. Immediately giving some hormonal pills and means dumping the hormones on her. So developing extra hair, blackening of these lines, all things, and obesity, hair fall, everything is the side effects. So don't believe giving medicine will change the environment of the body. So first try to be with nutrition and lifestyle modification. Alarming signs are heavy bleeding and not getting period for 3 months. For even for 3 months, 4 months, if you are not getting period, no worries. Take some time. This will everything. PCOD is reversible, right? You will learn that. So everything is reversible. Hormonal things are reversible. So no worries at all. So you have in front of you, doctor presented one case beautifully. See, with nutrition, everything reversed. So give some time. Only structural problems, genetic problems, that are very few, 10%, not more than 10%. So 90% will be treatable only with your lifestyle modification.
It's very strong, ma'am. Thank you. Thank you so much.
Thank you so much, ma'am. So with that, we'll come to this end of the panel now. So shall we go ahead with ortho or pedio, sir? What do you prefer? Okay, I'll start with the same topic, the parents. So my question to you, Pawan sir, when we take either the scenario of parents or the doctors, these days with the amount of infections, inflammations, low-grade fevers, post-pandemic especially, there was, I heard from doctors saying that having low-grade fevers are near normalcy now. So how do we address this? Is it that infections are increasing, the resistance towards it is becoming more, or is it the immunity that is going low? Yes, we all know holistic approach and lifestyle do help, but how do we actually take this into practice?
So one major reason I feel is like sleep, ma'am, especially the growth issues. And how many of you sleep here at 10 o'clock? Raise your hands. Oh, very good. What about 11? 10:30? Okay. What about 11? Who goes to sleep at 11? Very good. What about 12 people? 12? Busy people who go to sleep at 12? Oh, nice. There are some hands going up. What about 1 a.m. daily? Okay, great. Yeah. So 1 a.m. sleepers, please listen to this. There is a famous dialogue from movie Akhanda. Who is the hero in that Akhanda movie? Balaya. Okay, if you sleep at 10 o'clock and woke up at 6 a.m., that is 8 hours, and suppose you say, sir says that, I sleep at 1, but I get up at 9. So the 8 hours is coming, no? So do you think both are same? No, they look same, but both are not same. Okay? So 10 to 6 is the best time. 10 to 2, especially the 10 p.m. to 2 a.m. is the best period. If you miss that, the maximum rejuvenation happen at that time. Okay? So you have to ensure that that period is important for your growth hormone release, and also your immunity builds up during that time. All the stress factors which happen throughout the day will wash away during that time. But if you are missing, suppose 11, then you are losing that 1 hour of golden period. Then 12 o'clock, 2 hours of golden period. People who are sleeping at 3 hours, that almost 80% has gone. So both are not same. Okay? So how it is related to immunity and child, because nowadays, as ma'am told, screen time has been increased a lot, especially teenagers. You are not, most teenagers now, they sleep at 1 o'clock. They say that is the cool, that is the new normal. Okay? So, but you have to tell them both are not same. And one factor which is important for immunity, low immunity is very common concern for the pediatricians. The moment they come, they will ask us, my child is having low immunity, doctor, we are going to, that's why pediatricians are real, they are busy, because these children, they get every month almost all. So when we try to address the root cause, we have to address these lifestyle factors only. Before joining this lifestyle medicine, American board course, I was thinking only I was to just ask the medicine, I used to write some medicines like that, multivitamins, some immunity boosters like that. But when I started asking how many hours the child is sleeping, what sort of diet he is eating, these 6 pillars, only 6 pillars, 6 questions. After that, I can really formulate how much to counsel and all. So please go through about the 6 pillars, what questions you need to ask. That has really added lot of repetition to me because no doctor asks so many questions, right? So if you ask about the child sleep timings and all, so that has totally changed my practice also, okay? And I can correct them at the root, like that hero in that story, okay? So it's very important, low immunity and all because of poor nutrition, poor sleep, and also lack of physical exercise, sedentary habits with the kids are going on. Now we can see Chaitanya Narayana, you can see morning 6:37 it starts until 10:30 it will go, okay? So these are the nutrition you have to take care, your physical exercise. Stress is also for the kids. I think we are seeing this. If you address the 6 pillars, you can correct all those them. You know, you can improve their immunity and also their growth also has been improved with that.
Doctor, my question is, many children, even my own, my son, 12-year-old, often tend to mouth breathe.
Okay.
And at times, he snores heavily also.
Yeah.
So, I don't find him getting cranky or restless, but the other children, I find getting them, restless throughout the daytime or getting cranky. So, how important is the airway health connected to the immunity and the sleep and the growth pattern of the child?
Yeah, this is very important question. If you come and ask in Kukatpalli, who is the doctor who avoids surgery for adenoids, it's me. Okay, people will get referrals. I get referrals from that because of that. Because I did a pediatric allergy course. In that, my topic is adenoids and all, ma'am. So the people who are posted for surgery, when they came to know that, this is that they used to stop surgery, they used to buy some time and they used to come to me for that. Almost 90% we could able to reverse it. Again, what is the reason? We are finding the root cause. I am interested in the root cause. Pediatrician means you will find the root cause. Okay? So that's where root cause, if you do that, I have many testimonies like that. The people who are 90% blocked, advised for surgery, within 3 months we have reversed it to 50% like that. They are super happy because they have saved 1.5 lakh. So I always used to tell them, deposit that 1.5 lakh for the kid's name because that is the amount of money you have to spend. So airway health is very important. Like, again, holistic thing, we need to use our breathing exercises are very important. Nobody teaches, mothers and, start doing with your kids the pranayama, simple practices, what they advise. So this is very important. We need to ensure our kids get this knowledge from the beginning itself. So airway health is super crucial for the kids' immunity, growth and everything. And the kids with adenoids, what I found was their sleep cycle is gone down a lot. Their REM sleep cycle, they have a fragmented sleep, fragmented sleep. They won't sleep. If you measure their sleep quality, they have a very poor sleep quality. REM sleep, which is very important for memory and all, that goes down. That will directly impact their cognitive performance, their ranks, their understanding about the subject, their learning will go down. What happens when your learning goes down? Your earning also goes down, right? So that's why if you have to do the impact, we need to really address these issues. We should not let the people go into that. So now we have developed so much confidence in that the moment the child enters, we can know this child is having adenoids, that much. So it's become rampant now. Hyderabad and Bangalore have become the capital of one enemy is there, nobody knows, that is called house dust mites, which is the root cause for all these adenoids. If you address that, 80% of the enemy eliminated, that's all. Yes, that's a very important question. Hello? Yeah. So that's a very important question, ma'am. If you see adenoid faces, it's like that face was not theirs actually. They are destined to have another beautiful face. But because of these adenoids, their shape totally got, changed. It was a totally different shape, but parents never know that. That's why we advise if it is very big adenoids which is blocking them, not improving with the sprays and all, so we advise them to go for surgery. And surgery is, fortunately, it's a very simple surgery. If you do it in the morning, evening you can go home. The co-bladder surgery. It's called bladeless surgery, bloodless surgery. So they don't use blade and there is a bloodless surgery. Not even a single drop of blood goes. So it's so simple. But what it happens is, once that after 2 years or 3 years, that facial reconstruction, it is a permanent. It is irreversible after 5 years. So if you want to really act and do something, you have to do much earlier only. Once that shape goes off, it permanently changes, ma'am. So if you want to avoid, we want to give that beautiful face, what the God has destined for child to be, we have to act, we have to take seriously. Otherwise, we are going to, totally deviate from the normal pattern of the face.
Thank you so much, sir, for the wonderful insights. Really, adenoids is something which really disturbs me, because every single child from the 6th grade, 7th grade, especially in Hyderabad, every mother, I would be getting calls, suggest a pediatrician to whom we can go and get the surgery done. Definitely, sir. Now I'm going to refer to you so that, and also the septum corrections, and so enlightening. I'm so grateful for you for this. Thank you so much, sir. So coming to you, Harnath sir, now we will move to the more common problem that we see around not only the childhood, but everyone around, all of us, across all the age groups. Whether we have rice and tur dal at home or not, I'm not sure, but paracetamol has become a part of the day in every single home. So, sir, given the kind of body pains, people are, forget about fractures, surgeries, I'm not going to that extent. The simple kind of body aches people are going through, and this kind of tiredness and the physical flexibility or the stamina that people are not having these days. How do we address these simple problems, the posture issues or the balancing issues from the orthopedician point of view?
This is raising concern actually. Is it audible? Yeah, this is raising concern actually. Most of the complaints are not so identical. We can't conclude basing on the symptom itself. And we investigate also, we don't find anything, especially in lower back pain or fibromyalgias. We don't find any abnormality in any investigation. Especially nowadays coming to the 25 to 35 or 40 age group people. I do believe most of the problems are because of these lifestyle modifications. They are not going for any physical activity, sedentary lifestyle and eating habits. And as sir rightly said, sleep. In my opinion, I ask sleep about how patients are sleeping for two reasons. One is the pain severity. Because of the severity of the pain, patient is able to sleep or not. And another thing is rejuvenation. If he is not having proper sleep, body cannot rejuvenate. So I do believe that changing lifestyles is causing most of the time these kind of non-specific body pains.
So, but given the fact that thanks to COVID, our sitting time has totally increased, the sleeping times have deprived, we agree. But given the fact that, see, I want you to understand this concept that when a surgery happens also, to start with the movement, we take the help of a physiotherapy, which is nothing but a mechanical movement. If that is given the case, when there is a pain, why people end up into bed rest? Why don't they get up and move, and how do we address this from your point of view? When people have a lot of pain, or say plantar fasciitis, the most common these days, they say they have pain, so they will not do exercise. The reason for is could be anything. But how do we bring up a change in people's perspective that movement is the only solution for the ailments?
Absolutely. As you rightly said, most of the patients raise this question. If I am getting pain, how I go through this physiotherapy? And few conditions like plantar fasciitis and frozen shoulder, where movement is the only solution. Because of the movement, joint will get nutrition. Without movement, no joint will get nutrition, even though it is absolutely normal. So patient has to find a way, mentally as well as physically, to overcome this pain. So as he is unable to overcome on his own, he needs a help of physiotherapist, where he is a subject to somebody. Then only he is able to achieve these kind of movements in painful situations. And orthopedic principle itself is early mobilization, and as early as possible we have to send the patient to normal lifestyle. So mobility is the concern. So he has to find a way to mobilize the joint even though it is painful. Okay.
So when people come to you with these kind of problems. So what is the advice that you want to give to the general public, sir? Like, how do we educate people that this has to be done? Yes, we all know it has to be done, but how?
You mean plantar fasciitis or any kind of? Okay. No, I don't expect a total immobility. Total immobility is bedridden.
For all our clients, as we track the food journal, we track their activity journal, sir. So the activities have gone so sedentary that certain people, they don't even take 1,000 steps in a day. This is happening in our scenarios across the patients that we record every single day. So how do we bring up this awareness that the movement is the only solution? How we can bring up from a doctor's perspective, from your clinical point of view? We are definitely helping, yes, sir, because anything, when it comes from you, sir, that becomes a God's word, not from us. I have to say this. When it comes from a doctor's mouth, it becomes a magic word and they listen. So when we really want to address a larger crowd, you have to be the life force, sir. So how we can do this?
I suggest to go for morning walk by listening something, and prefer at least any physical activity, whatever they used to play previously. Develop a habit so that they can go. If professionals are concerned, they can start whatever the game they used to play previously in college days. They can develop those kind of things. Nowadays, if you observe, we are having lot of physical activity grounds, especially for the age of 30 to 40 also. And nowadays, I don't know how many kids are playing, but actually 30 age group are playing a lot. I can see a lot of sports injuries in 40 age group. Okay. So develop whatever you like. So whether it is a game or walking or running, whatever you want to develop, you have to develop. Find a way so that you can mobilize yourself.
Thank you, sir. Sir, that takes us to the personal me time. Engage in your own hobby time so that you love what you do and you do what you love so that you become healthy. So we have a question from Soumya for you, sir.
Good evening, sir. My question is for Dr. Harinath as well as Dr. Shravanti too. How often does long-term back pain come from weak core muscles rather than actual spine damage? And how important is early exercise after delivery to prevent back problems later?
Okay. In my OPD, if you believe it or not also, most of the patients complain with back pain only. If I happen to investigate each and every one, I don't see any specific reason in at least 80 to 90% of the patients, except rather than weakness of the muscle or stiffness of the muscle. So this is the most concerned thing when we are taking consideration of the housewives, any office works also. People who are working in office also, we don't see any physical activity related to their back muscle. Especially most of the time they are sitting or doing monopoly in work. Household work is also monopoly. So back muscles are getting weaker most of the time, and some people are also having vitamin D3 and B12 deficiency. Most of the time these will cause concern over the back only. So 80% of the time we see weakness of the back when they are having lower back pain.
Delivery, post-delivery, even it is cesarean or normal delivery, people will definitely come with a lot of backache. Why? Because during pregnancy, there will be lumbar lordosis. We'll call it as like this. See, stomach will come out and that spine structure that is called lumbar lordosis. It will go inside. So because of that, and another problem, all ligaments in the pelvis, pelvic bones and ligaments, they will relax. So that because of the laxity, they will have that pain, that toughness will not be there. So further, we will tell postnatal exercise. everybody can search for postnatal exercise. So you can start immediately. If it is cesarean or normal delivery, if you start doing postnatal exercise, this pain will not be there. But you have to start early. If you are taking 1 year, 2 years after that I'll start, means maybe you will not get 100% that relaxation, or that you cannot go back. So early, anything early to start. But it should be like a mild exercise. Start with mild, moderate, and go for the severe exercises. So that will definitely, you will give lot of, some people will tell it is just like a breaking my bone. The pain is just like breaking my bone. So don't take painkillers. First of all, I'll counsel. So these painkillers, even if you take, it will be for half an hour or 1 hour. Again, that pain will come back because that root cause is not relieved by the painkiller. So you do lot of postnatal exercise, definitely you will have that pain relief.
Thank you so much, ma'am. Thank you, sir.
So we'll just take an audience question because your good name?
My name is Udayavani. I would like to ask Pawan sir. Sir, you brought up about child sleep. So you told about golden hours in sleep, which I have to acquire. But I'm daily missing on that because of my child sleep. So I'm making, earlier it was like he used to play very long during night and used to sleep very late. So but I broke the pattern and I've changed his diet, his sleeping habits. I'm making him to bed by 9:30. He'll play by 10, then he'll sleep by before 10. But in midnight he gets up and he'll be super cranky. So even my sleep is completely disturbed because I have to pamper, because if I say one thing here and there, he'll cry to the sky loud. So how do I make him sleep throughout the night comfortably? So even if I'm offering food in the night, middle of the night, I'm asking. He says everything. He's just 2.5, but he's very understanding and very. I made him understand since first that you need to talk, you need to communicate with me so that I can do better for you.
Yeah.
So that process given me so much, I don't know, understanding in him. But whatever, if I say tell, Amma will do, he tells me clearly. Even if he's crying aloud also, he'll tell me clearly. So if I'm offering food in the mid of night, something, whatever, milk or something, anything, he's not accepting, but still keep constantly crying for 1 hour or something. So I thought it might be, well, before sleeping I made him sleep forcibly, so it's bedtime. No, he might be cranky, so he's carrying his emotions in the night. I tried that. One day I tried, like, Amma is here only, don't fear, Amma is going somewhere. Because sometimes I go out, like today I have come. So I have tried like that also. So 2-3 ways I have been trying.
Yeah.
So how do I make him sleep throughout the night comfortably so that he don't miss on valuable, what you call REM kind of sleep?
Yeah, that's a very pertinent question. Most parents ask us, middle of the night child getting up. I think some kids, younger ones, usually when they get up, if you feed them, they used to sleep, that is fine. But there is another thing, like, growing pains. At this age group, especially 2.5 years, there is something called growing pains, which will come more during night only. Okay? So it's like a muscle pains, leg pains, and when the whole body is growing, the bone stretches. All those pains, they will be, when during activity, it won't trouble the child. Child will not be, he will be jumping, running, and all those things throughout the day. But when night happens, when he calms down, everything settles, then usually they complain of the leg pains. So usually some kids show that, otherwise some people will just keep on crying. But if you start squeezing their legs, so that is a natural. Growing pains is a part of their thing, but that happens most of the times. And the moment you are squeezing their legs, they are comfortable, that is called growing pains. If there is any physical problem, the moment you squeeze their legs, the pain aggravates, right? But pressing releases the pain, that is a growing pains only. So that you can try, ma'am. Second thing is nightmares and night terrors. These are very common in kids, especially as you rightly said, if they see some, movies and something like that. So nightmares are like, how to differentiate between these two things is, when the kid cryingly wakes up and he started crying in the night, so whether he is opening his eyes and crying, or he is closing his eyes and crying. So that will differentiate. Suppose if a nightmare comes, they will just cry with a, they will get up with a cry. And once they see the environment, oh, mom is there, dad is there, okay, this environment is different, they will break down in the dream, REM sleep, their dreams comes, right? So that dream phase, again, he'll just get up and started crying as if it's a nightmare. Remember that nightmares are very common in kids. So for no reason, they will just get up and cry. So that if the child is opening their eyes and crying, that is called nightmare. And within 5 to 10 minutes, if you cuddle him, if you try to console him, he will understand that this is away from the dream world and he will sleep. But second type is like night terrors. So these kids, they won't even open their eyes. They're continuously crying throughout the night. So that is, they are in the dream phase only. That 45 minutes of REM cycle, the entire sleeps, dreams comes, no? Till that breaks. How it happens in half an hour, 45 minutes, because the sleep break cycle happened, and after that, again, kid goes back to sleep. So that is usually we see, night terrors are very common. So what we need to do is a routine, develop a routine sleep hygiene. So make them, play like that till they get tired. And if you can, if it's because of that, you can give simple analgesics will solve the problem. You can't keep pressing their legs whole night, right? So routine sleep hygiene, what we recommend is after having a meal and after playing and all, he gets tired, give him a warm bath and make his bedroom, 2 degrees lesser than the outside room. Just put on the AC, even in the winter also, you put on the AC for 10 minutes like that, keep the room cool so that the sleep goes deep. And he should not sleep on the empty tummy. He should have a full tummy and let him, take a bath, and he should go into the room where it is. And if the bed, put a mosquito net, give them the cozy feel. So that will definitely help the kid. And bedtime stories are the best time. You can really, subconscious programming can happen. So if you do that daily consistently, what happens is over the time, you will totally change. His quality of sleep will definitely increase, ma'am. Yeah, but
he's crying for persons who is not at home. So like my sister, cousins comes and they go back. He's crying for them in the middle of night.
Those are like a temporary phenomenon only. But if it's happening consistently, look for these changes.
Yeah, thank you so much, sir.
Thank you so much, sir. So I'll hand it over to Revati for the...
Hello, sir. My question to Pavan, sir. My daughter is 9+ years, so she has adenoid problem. So we used spray. For a certain time it is okay. Then again it elevates. So every year during winter she has that problem. So now she is fine because through some diet and all, I am just managing it. But I want to ask, how about adenoids and hormone imbalance in future?
Yeah.
Hormonal
So
imbalance.
it may not be directly linked, ma'am, but again, it affects the poor quality and their cognition. Everything goes in a cycle. So, why this happens repeatedly when you are using spray, it is fine. And after that, because spray is like, it will shrink the thing, but it won't address the root cause. So first we need to address the root cause by doing an allergy profile. So which will help the child what the child is, because adenoids is a, root cause for adenoids is the allergies only. If you don't treat that by finding the root cause, there are other types of allergies. This is nose allergy is adenoids. He can have a respiratory allergies. The kids who are having cold and cough without fever, that means they are having respiratory allergy. They don't have fever, but cold and cough persist for 10 days, 15 days like that. So that is a respiratory allergy. Then eye allergies, they must get continuously scratching their eyes. Skin allergy, itching, rashes and all, arterial rashes. That is skin allergy. And food allergies. These are all 5 types of allergies. The adenoids is only one. So we need to really address the root cause. When you address the root cause, all the other symptoms also you can prevent in the future. The asthma. These things can be preventable. Skin allergies if you address the root cause. So finding out what allergens the child is sensitive to. So if you address that point, ma'am, as I told, house dust mites is the major enemy. If you just do research on that and if you eliminate that from the child's ecosystem, it's very tough. Now there are therapies also which have come, but if you can really take that, at least you can find a lot of improvement in the kids. And you need not use the sprays for a long period also.
Thank you so much, sir.
Thank you so much, sir.
Good afternoon, everyone.
My question is, how does Ozempic fit a holistic reversal of chronic conditions like insulin resistance?
So Ozempic and Mounjaro, Wegovy, Zepbound, these are all the molecules which, so the question is, they are called GLP-1 analogs. So our body produces GLP-1. The problem with our own inherent GLP-1 is the half-life is very short. So that physiological GLP-1, the effect of that is aggravated through this Ozempic molecule, which will work in multifold factors. One is it can trick your brain into feeling you feel full with little servings. It will increase your satiety, and there are a host of mechanisms. In fact, if you understand bariatric surgery, when we were like 20, 30 years ago, we never understood how bariatric surgery showed such dramatic response in terms of diabetes remission and weight loss, because it was a very minor surgical procedure. That bariatric surgery was in fact working through this molecule called GLP-1. Through that, they found that this is a molecule that was effective in bariatric surgery. The pharma industry took that up, and now they have launched these molecules. So this molecule is going to be there for next decade or so. So the question now is, this is the only way we are seeing dramatic improvement in weight reduction and diabetes remission. To the extent American Diabetes Association now recommends these molecules upfront in a type 2 diabetic, alongside SGLT2s, now before sulfonylureas and other drugs, or even insulin for that matter. GLP-1s and SGLT2 are way up after metformin.
So thank you so much, panelists. It was so insightful, and we are very glad and happy that, as Jyoti said, any word comes from a doctor's mouth. It's like, from the God. And we are very glad that you actually highlighted the lifestyle, the importance of lifestyle. And then only comes the medicine. So what I would like to conclude here is, if the person is clinically safe, not in an emergency, then we can definitely give them a chance of, going forward for the lifestyle modification, which will actually reduce the burden of your practice as well, because you are all like expertise in dealing those emergency condition where you are like saving their lives. And the lifestyle modification actually reduces the burden overall, and it improves the quality of life. So what here we want to conclude is, it is not just the quantity what we are looking into, like not only the biochemical parameter, not just the BP reading, not just the weight, but rather the quality of life, which has to be highlighted, and that has to be, created more awareness about. So it could be like, better sleep or better stamina or better improvement of overall life. So that is what we all like aiming for. And now we feel that it is high time that we start having that collaboration kind of thing where a health coach is always there to assist you in terms of assessing a patient, because the history taking becomes very vital. That's what we were able to listen from all of you, like the root cause analysis. And Dr. Suresh always says us, health is by design, not by default. So that's what we feel. And by design, definitely it is possible for everyone to lead an optimal life, optimal health. Yeah. Thank you so much, everyone, for enlightening us, and thank you so much, healthcare professionals, for your questions.
So to conclude, even I want to tell one thing: holistic approach. As we are like doing a CME on holistic approach, definitely early diagnosis, long term. You should means with patience you have to wait. Don't hurry for the shortcut managements like going for surgery. निकाल दो uterus निकाल दो. What is this? Uterus निकाल दो, कुछ भी है तो निकाल दो. What will left with us? So you have the beautiful body. So I'll tell to my patients, you think of your body. You don't listen to anyone. If you want to be happy, healthy, do for yourself. not for Amma, Nana or anybody. You are doing for yourself. So for chronic illnesses, you need lot of patience. So lot of counseling, lot of lifestyle modification. Definitely you will come out. Don't be in a hurry to go to a doctor. If I tell no need of surgery, Amma, you have sometime means going to other doctor and doing surgery. So that is wrong. First of all, even in your families, you have to tell that have patience, have courage, take support from these counselors, nutrition support and psychological support, and have a healthy life. Don't be in a hurry. And definitely lifestyle modification is doing miracles nowadays. So going for organic food and timely. Sir, as said, sleep is very, very important. Not going into stress. Everybody is in stress. I don't know what is this stress. That is not there previously. 2000 के पहले कुछ भी ऐसा stress का word नहीं सुने. So now everybody, I am in stress. That is like a fashion they are like telling. Okay. So hope you will all like utilize and spread these things. You are not supposed to spread this. क्या हुआ serial में आज, कल क्या हो रहा है? That is not the thing. Whenever you have the time, even in WhatsApp, spread about this holistic approach of the chronic diseases especially. Acute diseases, of course, we have some of the protocols, but chronic diseases, you help other people in counseling part. Thank you.
Good evening,
Thank
sir.
you so much. Thank you so much.
Good evening, sir and ma'am. I want to ask a question like...
No, we are running out of time, so probably we'll take it off stage, not on stage. Thank you
Okay,
so
ma'am.
much.
Energy has gone down, so I teach you one exercise. It will raise your energy, okay? Are you ready? Keep your mobile away.
Basics, they were asking questions, no? They were prepared. Go. Three of you this side, three of you that side.
I asked an insightful perspectives. Today's discussion highlighted on an important truth. Chronic diseases develop over time and healing is a process. Reversal does not always mean eliminating a diagnosis, but reducing dependency, restoring function, and improving the quality of life. Medication, lifestyle, nutrition, mindset, and emotional health work best together, not in isolation. Most importantly, the patient plays an active role in healing. Let this conversation inspire deeper collaboration and a more integrated approach to a long-term health. Thank you.
Thank you, Swapna. So, a little honor and gratitude for your time and presence here. Dr. Pawan sir from Jyoti. Revati. Thank you, sir. And to Dr. Shravanti, thank you so much, ma'am, for being here. Thank you, Dr. Hari, for being here. From Neeraja, Saba. Thank you, Dr. Sham, for being here and being so patientful in answering all the questions. Thank you so much. Dr. Sham, we would like you to stay back. Please stay back.
So, hello everyone. I have this habit of gifting only books. So, when I thought of inviting an endocrinologist on the panel, I thought of so many people. Okay, but my association with Dr. Sham is quite interesting, I would say, and quite impactful on the way I look at my own practice. So when I was sitting with sir in his OP, and he used to send each and every patient to me for dietary and lifestyle advice. And end of the day, once the OP is over, we sit together and he'll ask me, Suresh, how many patients did turn up? Sir, only 2. What is this? I have seen 15 patients. I asked everyone to visit you. Okay, that's how passionate he is. He believes in lifestyle medicine, nutrition, fitness, and all these things. Okay, so that's what I love about Dr. Sham and Bhavani madam. When this craze of Ozempic and Monjaro is taking over the world and the country, I thought, like, who would answer this question? There is a big elephant in the room and you need courage to answer that elephant. And he beautifully answered that. I am totally blown away by your answer, sir. Because I don't know how many of you got it. He mentioned that 20 years ago when bariatric procedure was started, I attended so many conferences on that. Even surgeons are not sure how it is working, right? What is it that is working in helping people lose weight? He simply said, okay, now the pharma industry is able to figure out what is that missing molecule that is going away from the gut. It is GLP-1. And now the pharma industry has come. And I don't know, if you could get the sarcasm in his tone in the last sentence, right? For next decade, the Munjaro and Ozempic. But having said that, being, the kind of ethical practitioner he is, and I have known him for years, and have worked with him, I feel privileged, and he made all the justice to the panel discussion with his insights. Thank you very much, sir. And whenever I give a book to someone, usually I give the books that I have read and I have learned something from. And I think that, okay, my friend or my colleague, it would be nice if they also read it. So this is one of the books I really like a lot, and I bought it for him. So thank you. Barefoot walking and barefoot running. Stress release. Dr. Pawan. not the same. Okay, I need to tell a couple of things about Pawan. I know Pawan through heartfulness meditation. So don't assume that I do meditation. I'm not that kind. He is a good boy, a good doctor. Uh, so we got connected instantly. Okay, we both love this heartfulness. I mean, lighter moments a lot. I tease him a lot, and he teases me a lot. But he respects me equally well, like a brother. So when I was like thinking about a pediatrician, because these days, even my sister's kids, so I send them to him. Okay, so whenever she comes up with a problem, so now the book that I wanted Pawan to read, I mean, I selected this particular book, Cybernetics, because I love this book a lot, and the reason why I'm giving it to him is he recently went to Himalayan base camp. Okay, a big route.
Secret behind this guy. Mindset matters, and he took a class for us. We are 10 pediatricians who have recently went to Himalayan expedition. That's a beautiful journey. 14 days of walking. The sunrise to sunset, you have to keep walking. That's all. So that was the thing. But we are not that great physically fit because our coach coached us for 6 months, but still we are not in shape. We were really worried, So this guy came for our meet, before launching meet. So he gave a talk for 15-20 minutes only on the mindset. So that changed everybody. And everybody, I was the person who inspired more there. So we are able to complete the entire journey and came back successfully. Okay. So that is a big thing, biggest thing everybody appreciated. Everybody understood that mindset matters most. Everybody remembered Suresh then.
Thank you for the opportunity. And this book is quite amazing. Okay, and Pawan, I am going to ask you some questions whether you are reading this book or not, because
something amazing for every holistic nutrition specialist. This really matters because we have seen people who have done this nose surgeries and all, some microsurgery. What the scientist says that even the microsurgery done, that will entirely change their perception about themselves, and the way they behave, the way they walk, the way they talk, everything changes of a simple plastic surgery. Yeah, simple plastic surgery that has changed. How mind has, started believing that whatever they think that was a crooked nose, something like that, crooked nose, and they were shy to talk to people, with the low confidence and all, low self-esteem, by simple correction. He says that nobody notices that correction, but by just going to a plastic surgeon and get it corrected, it will change their perception. Again, their confidence goes up, the self-esteem goes up like that. So such is the power of your mind. This book, I think, addresses that. I think it is must for everybody, as Suresh said.
Thank you, Pawan. Thank you for coming. And next, I would like to invite Dr. Harinath. Please, you are panelist.
Small book.
So I think Dr. Bernie Siegel, the MD, he worked extensively on cancer patients, and he is like Patch Adams. I don't know how many of you know this movie, Patch Adams, but what I like about this movie is he never, dare to cross the scientific, the thought process, the premise. So he would like to explore or expand the boundaries of scientific premise and make every healing that happens in the body, keep it scientifically. So Dr. Hari and I used to have quite a few arguments, long back when he was a kid. I know since he was a kid, a teenager at least. His brother is my classmate. And why I chose this book for him is, many of you don't know that he is extremely talented, not only gifted, but talented. Tomorrow, if you have MSET exam, nobody would be playing cricket in the ground. Okay, we went there for his MSET exam. His brother is tense. I am tense. One of our friends, he's a big doctor in Kakinada now. All three of us are looking at him. He is going to write MSET exam tomorrow, and he's going out there in the ground, and nobody dares to question him. See, that is the level of knowledge that he has, confidence that he has. And no wonder he did so many fellowships, and after MS Ortho, he did MCH in Ortho. Despite going through all these things, what I liked in him is, he would, what I would say is like, he's more of a naturalist. Okay, don't get, carried away by his looks and all these things. He would give up a surgery if it is an elected and another doctor is available and go for playing cricket even now. That much how passionate he is about his life. He is a marathoner. He runs marathons with his brother and with his uncle, paternal uncle, and all of them are a club. I used to go, but not for running, but for something else. Okay. So this book I got introduced in my first year medical college, and at that time I didn't read it, but some 15, 16 years ago I read it. But it is totally a doctor's language with a human touch, but more doctor language than human touch. But I think this would introduce him into this new perspective, being the specialist surgeon he is. Thank you very much, Hari, for coming and being here.
Thank you very much, brother.
Sravanti ma'am. So we needed a gynecologist and for panel, and in fact we were looking. I mean, this conference is supposed to happen in the month of July. So I was looking for gynecologists and who would be the right person with an open mind for new possibilities. Okay, what happens is, whatever we read in medical college or whatever we see in our practice, or a period of time, our minds get closed. Okay, so there is a saying, the mind is like a parachute, very dangerous if it is not open, right? So most of us, because we are prescribing something, it is giving results, and so we tend to believe, everyone tends to believe that we are right. It is nothing wrong. Okay, but the moment we keep opening our mind to new possibilities, that gives us an opportunity to explore new paths. Okay, and I told my younger sister who works with All India Radio, and I'm planning this conference. I'm looking for one gynecologist. I don't know whom, because I don't know much of gynecologist friends. Even my batchmates, I don't know who have done that gynecology. Then she suggested, okay, I recently interviewed Dr. Sravanti. She is amazing. I mean, she is speaking people's language. Okay, why don't you get in touch? And immediately I called her up in the month of June, and she agreed. But we couldn't do in month of July for various reasons. But I'm feeling guilty, and I called her up, ma'am, I'm doing it in December. Would you like to come? So she immediately said, first of all, thank you very much, ma'am, for accepting that. And the reason why I chose this book and why I choose Sravanti madam, because when I'm calling the panelists, I do a lot of research. So I watched one of her videos, YouTube videos, where someone asked her, why did you participate in Mrs. India competition? I mean, I don't know how many of you know this, but she is Mrs. India winner, representing India on world stage. And someone asked her, being a doctor, why did you choose to participate in this? The answer literally bowled me over. See, I want to create awareness about women's health issues. If I am a doctor, a gynecologist, there are hundreds and thousands of gynecologists and doctors, right? They are creating awareness, but how many people are listening? But people will notice me, right? May not be saying the same thing, but being a celebrity, becoming a celebrity, the message will reach more people. And for people, she has done that, not for herself. Okay, to take the message of women health across. So why it is important to me? I'll conclude with a small story. My mother got some serious emergency a few years back, almost like a decade ago. And she was in coma for almost like 3 days. No doctor could figure out what the problem is. All my friends from US, UK, everywhere, we were discussing in our group what could be the condition and all. Nobody could do that. So, and one day it has gone up to using 1000 units of insulin, one single day. And still her sugars are not budging. So finally, I mean, like she started responding on 4th day and she has come out. And while discussing with one of the doctors, the chances are, so I heard some kind of word. Okay, immediately something snapped in me. I burst out, okay, over the doctor. See, my mother is not a number, a statistics. Okay, we use statistics, but we cannot reduce patients to statistics. You need that human element. Whenever I see any patient, that thing reminds me. Okay, so this story is about one such woman who is diagnosed with cancer, and doctors gave up, right? And everybody comes to pay the last rites, I mean last respects. But suddenly she becomes dead, brain dead, but she comes back to life and writes this book, Anita Moorjani, Dying to Be Me. Okay. So even for her, I did a lot of research, how the doctors world over started criticizing her, downplaying her claims and all these things. It happens. But for her, it is her life. A life saved is a life saved, period. It is not a statistic. Right? For me, my mother is my mother. Nobody can replace her. Okay. Each and every patient must be one. The very purpose of HolistiCon is to bring that message to the people. Each person is different. They are not numbers. Yes, statistics, they do help us. Numbers are important. We have to look into the values and we have to follow certain protocols. But when it comes, certain thing is helping a person. Okay. So why not explore that? So, and I thought this would be the apt book to present Dr. Sravanti. Thank you very much, ma'am.
Sir, as you are telling, so whatever there in the books, when you come to the practicality, lot of changes, sir. It's not possible to go according to book. So we are dealing with your minds, your body. So whenever any patient comes to me, I'll feel like my family member. In one of the movie, there were like, I treat like a family member means then you cannot do surgeries means no. How? Why? How? We will, because once you I think you are my family member, then I'll have a lot of empathy, human touch. That is more important. So all things will not be done with the money or medicine. Always human touch, that love, affection, empathy, holistic approach, then only you will come out of the disease. So for you, you are, like for me, you are hundreds of patients. For you, you are the single person. For your family, you are important. So I have to treat 100 or 10,000 or 1 lakh, everybody like my first patient. Even it may be HIV patient or Corona patient or whatever may be. During Corona, we have treated thousands of patients, even though we have threat. So I wore like 5 layers of dresses to treat a severely infected Corona. I did the first delivery in Yashoda hospital. Nobody wants to touch her. See, being a doctor, it is a boon for us. God given us, like we are like serving people. Serving people is serving God. So this is the best thing we got in our life. And see, it is the again comes to the people whom with we are interacting, like sir. So we are all having the same mindset, not for the business, not for the money. We are doing something else. Of course, money follows if you do properly. If you do genuinely, if you do honestly, money will follow. Don't, for the students and youngsters, I am telling, don't be behind of money. You be yourself and you create histories, then money will come. Thank you for the opportunity, sir, once again.
And please stay back. A little gift for our case presenters from morning that they have been doing. So to appreciate and acknowledge and congratulate them. So I call upon Swapna for the case of varicose vein that she has presented. I call upon Dania Irfan for the case hemorrhoids. And Saba for nephrotic syndrome. Guys, we can give a big round of applause. Saba has also traveled miles across, just coming here just for 2 days of this HolistiCon. Yeah. Location. Sandhya. Next is Sandhya for gastritis with weight gain. Which case?
Type 2 diabetes.
And the next goes to Karuna ma'am for type 2 diabetes. Nikita, I call upon Nikita. Revati, please do come on the stage to receive your memento. So Vijay Muthamari's case is yet to come. If you could wait another 10 minutes, we will be looking at a case that she's presenting on FoodCon.
Myself Saima, and I am here as a client of Prasanna ma'am to share my healing and transformation journey with the H&TP approach. I was dealing with an eczema condition for about 1 to 2 months, and during that phase, it affected me not only physically but emotionally and also mentally. I faced sleepless nights, mood swings, difficulty in thinking in a positive way, constant overthinking. Through this process, I have gained around 7 to 8 kgs of weight. Around the same time, I was doing my internship at HCAH Suvitas, Somajiguda. It is a rehabilitation center where I was introduced about a holistic way of understanding the health. There, my dietitian explained me and guided me about this holistic approach. So here I explored the H&TP approach, which made me reflect that whether depending only on medicine was not the right long term. It is, we need to go through it with the root cause. Through this reference, I got to know Prasanna ma'am, and from the very beginning, she guided me patiently through every step of this process. I often felt lonely and emotionally low, struggling with overthinking, anxiety, depression, and unexplained emotions. But the H&TP approach helped me understand the deep conversation between the mind and the body. H&TP taught me that healing is not just about the diet. It focuses on the root cause correction through personalized nutrition, improving gut health, reducing internal inflammation, lifestyle changes, and mindset work. So as I followed everything exactly as ma'am guided me, especially the let go procedures, mindset sessions, and routine corrections. I started seeing real changes in myself, which encouraged me a lot. And gradually, my eczema also improved, and I started reducing my weight. So here, manifestation played an important role during this journey in my daily life. Then I started being positive, emotionally balanced, and mentally strong. And I was genuinely surprised to see how these internal changes reflect in my health and life overall. With this Prasanna ma'am's constant support through all the sessions and guidance, this journey transformed not just my skin, but also the way I think, live, and care for myself. So here, I am thankful to Prasanna ma'am, the H&TP approach, and each of you for listening this. Thank you, everyone.
I will present a case of 61-old-year woman with chronic foot-corn disease. Okay, for over 30 years, associated with pain, associated with pain and reduced mobility. Despite of surgery and routine care, her symptoms persisted. Second slide. The main problem was recurrent foot-corn causing severe pain during walking and standing over 3 decades, nearly 3 decades. She underwent 2 corn surgeries in the early 1990s, but the condition recurred. Over time, she developed poor sleep, fatigue, and a hatchback postures. Clinically, there was no acute pathology explaining ongoing pain. Third slide. Further assessment showed issue was not structural alone. She had a yearly caregiving responsibilities, long-term emotional suppressions, and chronic stress with limited self-care. Okay. Next slide. So, holistic integrated view, feet represents stability and support in daily life. Chronic corn reflects prolonged suppression of physical and emotional pressure from sustained responsibility. The approach focused on integrated lifestyle interventions alongside routine medical care. Okay. Physically, just comfort and circulation to support her balanced life diet, simple balanced diet, garlic, milk, and regular oil application on her foot. This is the one I given. And an emotionally gratitude journal